I'm Vincent Simpson. I'm a diabetes and endocrine registrar based down in Exeter in Devon. And for the last 3 years, I've been increasingly interested in improving the sustainability of diabetes care. I've been working on the pen switch programme, which is aiming to switch more people from disposable insulin pens to reusable pens, with Deepthi, Lavu, who's an academic GP. So it's quite a complex question in the sense that at the moment we don't really know. There has been a little bit of work done in this area. The things we do know is that actually doing what we're doing already in terms of improving people's diabetes care, making sure their glucose is as well controlled as we can do, actually is by far the best thing we can do in terms of the environment as well. So even reducing HbA1c by 11 millimoles can reduce the carbon footprint of that person living with diabetes by about 40% by preventing them from going on to dialysis, by preventing them from getting cardiovascular disease. So we know that good diabetes care is important, but in the setting where we can do good diabetes care but there are similar products, that's where I've started looking at it. And for instance, the area I've been interested recently in is disposable insulin pens. So in the UK alone, we prescribe about 70 million disposable pens every year. It accounts for about 1,000 tonnes of plastic waste and about 10,000 tonnes of carbon dioxide. Or to put that in car miles, it would be the equivalent of us driving 26 million miles less on the road. So it's quite a big problem, but we also know that it's just the tip of the iceberg of what healthcare is doing to our environment. And this is one area where actually we can do something now. Some of the other things are going to take years of development and putting new systems in place. So we've really been advocating for making reusable pens the default that we offer to people, and having disposable there if we need it, with recycling schemes where they're available. So we've been doing this on a bit of a shoestring. So both myself and Deepthi are not employed to work on this. This is kind of something we've been doing in our spare time. But what we have done is we realised it was an issue. We got together, we wrote local guidance on kind of what is best practice currently. We've been advocating for reusable pens to become the default in our local formulary. We have also reached out to people living with diabetes to help them promote it. We've got a BBC Spotlight to kind of get this work out there. And we've also engaged with GPs, pharmacists, you name it, anybody who's willing to listen, we'll talk to and we'll kind of get them on board. And although we've been doing this slowly but surely for the last 2 to 3 years, we've been using open prescribing data, so we've been able to track what's been happening. And over that time, insulin prescriptions have gone up by 12%, but the amount of disposable insulin has gone down by 5%. So it might not sound like massive amounts, but that's about 4,000 less disposable pens over that period of time. And we're talking about 2 people who are very engaged but not funded managing to do that. Just imagine what could happen if this actually became national guidance, became part of what NICE recommends, became part of what Diabetes UK recommends. In one pharmacy, they were able to utilise funding that wasn't actually about sustainability, it was about switching to a different insulin. And they then said, well, we're going to be having these conversations anyway, we'll just switch people to reusable pens. And they found that were able to switch 86% of the people across, and they stayed on reusable and were very happy with it. And from everybody that I've talked to who's been happy to switch, they've been very, very happy with the switch. And previously had not even known reusable pens existed. So in that time, we've managed to save 63 kilograms of plastic and about 379 kilograms of carbon dioxide. It's a drop in the ocean, but it's moving in the right direction. So the good thing about this switch is it's not just good for the environment. So I've talked about some of the benefits. So it reduces plastic waste by about 90%. It reduces carbon footprint by about 40%. In terms of finances for the NHS, it can save between 1% and 5%, depending on what insulin you're using. And for patients, it uses less fridge space cartridges. They don't need to get their sharp spins collected anywhere near as much, so it's 4 times less sharp spins. And then on top of that, because you have to store your insulin, the fridge cartridges just take up less space in the fridge. So if you've got a small fridge, you're not having half your fridge just filled with insulin. So it's a win-win overall. The very few people who don't manage on reusable pens, it's usually because they struggle with undoing the pen. So a reusable pen, for people who aren't diabetes experts, it's a bit like having a fountain pen. You have to open it up and put a cartridge in. But that's in the minority. We're really talking about people who are incredibly frail, and actually they're probably going to end up having carers very soon. The other people that I've come across who struggle with it are people who have quite chaotic lifestyles and have pens scattered everywhere. And so obviously if you've got 2 reusable pens, you kind of have to look after them and care for them. But again, they're in the minority. I think just start. I've always kind of wanted to be more sustainable in my personal life, and I do as much as I can do with the resources I have available. I've got a family and we have to kind of get to work and things like that, but we're constantly looking for areas that we can improve on. But what I've realised is that actually in our work we have the potential to have a significantly or even exponential impact on the environmental component of the care we provide. And at the moment there's a lot of low-hanging fruits which, if we just change the way we think, wouldn't affect care, or if anything would improve care, but would have quite substantial improvements in terms of the impact it was having on the environment, the resources it was using. So just get started and you'll be surprised at the things you can get changed. And then the last thing to say is, if you can go on a carbon footprinting course. It's not as difficult as you think, and actually it gives you a good overview of kind of what impacts on the global warming potential of a product, and it allows you to interpret the research and information out there and understand when things are realistic, or how you can kind of implement them in the redesign of your services or prescribing habits.